Currie, followed by the honourable member for Edmonton-Calgary.
Thank you, Mr. Speaker. I want to ask some more questions about support services for the brain injured today. I want to thank the Minister of Health and the Minister of Seniors for meeting with me last week and for taking an obvious interest in this issue. But they've been busy. I've been busy. We haven't had a chance to connect since late last week. And Alberta Health Services, whose motto these days seems to be "We're not happy till you're not happy," continues its relentless push to relocate clients who want to stay where they are. To the Minister of Health, will the Minister please ask Alberta Health Services to hold off on moving any more of these clients at least until after the holidays?
The Honourable Minister.
Thank you very much, Mr. Speaker. As I believe the honourable member knows, based on our meeting last week, I have endeavoured to get additional information from Alberta Health Services with respect to transition of these residents. My understanding today is that, pardon me, is that all 6 of those residents have moved to their new placements. There is, in fact, additional funds that have been allocated by AHS to provide more programs and services and enhance staffing levels to these residents in their new places.
The honourable member.
Thank you, Mr. Speaker. But the question is, turns around the kinds of services that are available in one ministry versus another. To the Minister again, given that the families of these clients have asked to have support services for the brain injured transferred from AHS to Alberta Seniors, and given that he, the Minister of Seniors, and I are discussing whether this might be feasible in some fashion, will the Minister again ask Alberta Health Services to please delay the relocations?
The honourable Minister.
Mr. Speaker, the honourable member does point out that in our meeting he did raise the policy issue with us, and that's the question of the appropriate program through which these services should be provided. That is a question that we have agreed to continue to discuss. The Minister of Seniors is a part of that discussion. With respect to the relocation of the residents to which the honourable member refers, I've said before in this House, and I'll say again, I'm thoroughly assured by Alberta Health Services that the appropriate staffing and programs and services are in place. The honourable member. Thank you.
Thank you, Mr. Speaker. To the Minister of Health again, since a maximum of 21 clients are involved here, given the wishes of their families, and since this should be relatively easy, will the Minister agree to support setting up this transfer of support services as a pilot project and instruct AHS to leave the clients in their homes while we all work out the details?
The Honourable Minister.
Well, Mr. Speaker, I'm in no position to make such a commitment on behalf of Alberta Health Services or anyone. The fact of the matter is that the new placements for these residents were determined through a request for proposals process that was administered by Alberta Health Services. The agency to which the honourable member refers did not bid as part of that process. I want to continue to state that I'll work with the honourable member to address the policy questions that he's raised. I think it's a valid discussion, but as far as the transition of current residents, that matter is proceeding as planned.
Honourable member for Edmonton-Calder, followed by the honourable member for Edmonton Riverview.